One of the main things that can prevent people experiencing chronic pain and other symptoms from healing is the amount of misinformation around chronic symptoms that they have to deal with. And in this video, I'll be tackling 3 of the most common myths surrounding chronic pain and symptoms and tell you about what is actually possible. Hi, I'm Rob Lieblein. I'm a certified pain recovery coach, and I'm also a former chronic pain sufferer. And I found out firsthand during my period of chronic pain and symptoms just how much bad information there is out there. And looking back, I can certainly understand why believing some of that information prevented me from getting better faster. And as a coach, I see a lot of my clients coming in to work with me with the same kind of preconceived notions that simply aren't true. So let's jump into some of these main myths that get in the way of healing. So the first of these myths is that chronic pain has to equal physical damage. And it's no surprise that the majority of us probably feel that way, or that's a belief that we hold because it's so prevalent in our society, and our medical care practitioners reinforce that. They're really good at dealing with disease, injury, and that's what their training has taught them. However, illnesses pass, injuries heal, and if you've already ruled out some of the more serious medical conditions, if your pain and symptoms are chronic, then it becomes a matter of the brain misinterpreting signals it's getting from the body and actually causing that pain. So things like emotional overload, constant stress, trauma, and just the daily stresses of living can actually cause physical symptoms in our body that aren't going to be responsive to traditional medical treatment, because you can't address a symptom when you haven't identified it correctly. So if nothing's broken, if there's nothing to fix in the body, trying to fix something that isn't broken isn't going to help you. The second myth is that pain is inevitable as we age. Now, lots of the people I work with are in middle age, and of course, our 55-year-old bodies are not the same as our 25-year-old bodies were. We can't always do the same kind of things that we used to when we were young, and even Tom Brady had to retire eventually. Now, that's one thing, is the normal aging process of the body. But when it comes to developing symptoms that are interfering with our daily life activities, that are even perhaps disabling to us, there really is no reason that we should expect that level of pain to happen in our lives just from aging. Now, another thing that helps reinforce that idea is the imaging technologies that we have, whether it's X-rays or MRIs, that can show certain levels of degeneration, say in our spines and in our joints, whether it's arthritis or some disc degeneration. And that would naturally lead us to believe that those things are the cause of pain, when in fact, there's a growing number of studies out there showing that there really is no correlation between that kind of degeneration, or what is really just natural changes in the body as we age, and our levels of pain. And it's important to keep that in mind as you may be looking at your own imaging results, because what you're seeing in the pictures does not have to equal pain. And I'm going to do a separate video just on that kind of research that is showing the miscorrelation between pain and what's sometimes called gray hair of the spine, or just normal abnormalities in our bodies. Now, the third myth for us to tackle is the idea that chronic pain can only be managed. It can't be healed. And the traditional medical approach is to treat chronic pain with medications, with physical therapy. And while these approaches can provide some relief, sometimes temporarily only, they also reinforce the idea in our minds that there is something within us that's broken and can only be managed, that actually can't be healed. And that actually helps perpetuate the pain-fear cycle that we may be caught in, and it is in fact the thing that's causing our chronic symptoms. Now, the truth is that the brain is changeable. The brain is neuroplastic, and that means that learned patterns of pain in the brain can be changed. They can be reversed, and new patterns can be implemented in the brain. And that can actually lead to true healing, not just the managing of our symptoms. So the overarching good news in all of this is that once you understand the role that the brain and the nervous system play in creating chronic pain and other symptoms, that's when you unlock the door to recovery. Healing isn't about fighting the body. It's about gently retraining the brain to feel safe and secure, which will allow you to begin to let go of your pain and your symptoms. Now, I also want to reinforce the importance of ruling out any serious medical conditions, whether it's fractures, infections, tumors, those sort of things, before you undertake a mind-body approach to any of the symptoms that you might be experiencing. But once you rule those things out, you've already started the process of sending more secure and safe messages to the brain. And you can continue on that healing path with confidence and with optimism. So as we bring this video to a close, I would love to hear what your experience has been. What kind of myths, misinformation, or just overall confusing information have you heard about chronic pain and the possibilities for recovery? Drop those ideas into the comments below. If you have found this video helpful, hit the like button and subscribe to the station to keep getting more information on mind-body approaches to chronic pain and symptoms. And remember, if you feel like you want more personalized attention as you recover from chronic pain and other symptoms, you are welcome to schedule a free 30-minute consultation with me. The information for scheduling that appointment is in the description to this video. And I look forward to seeing you in our next video. And remember, chronic pain is not a life sentence.